Chair, eminent panelists, distinguished guests, ladies and gentlemen. What my topic is going to be, I'm going to be talking today about ecosystems that funnel innovations. And I think what's probably relevant, and given the mix of the audience in the room, I think Dr. Purohit has made it pretty clear that India has innovations that are far-flung across sectors, and India is widely seen globally as a major innovator in pharmaceuticals, technology, and increasingly in connected devices. The question really is, how can India innovate for India itself? And if you really look at health as a sector, India is probably one of the most exciting places anywhere in the world that we would see when it comes to innovations. The reasons are quite simply this. If you break down health and look from a system point of view, broadly, there are three big challenges any health system has. It's to provide access to healthcare, and India has a population of 1.2 billion. So providing access to high quality, and that's the next question, because India, the law of averages don't work. Being able to provide an acceptable, relatively high quality of care at an affordable cost, a cost that is affordable to both citizens and to government. It's a three-pronged challenge. I can even venture out to say that the scale of the challenge is significantly larger than probably most countries around the world. And if you really see within the broad, these three dimensions of access, quality, and affordability, if we start looking at subsystems that has to support this scale of challenge, whether it is in terms of health systems delivery, financing, innovation, capacity building, I think the ecosystem of private sector and not-for-profit sector innovating to come up with solutions that are relevant for India are going to be very significant. It's going to be one of the major catalysts of change going forward. And high-quality, affordable health for all is one of the major sustainable development goals for nations going ahead. And I think it's going to be a key area. And thanks to the organizers for convening this workshop at a very opportune time to discuss this. I represent an organization. I head an organization called Access Health International. The vision of Access Health International is everyone, no matter who, no matter where, and no matter what their age, have a right to high-quality, affordable healthcare. We work in 6 countries around the world, and we work in designing health systems that are more efficient and support the vision, what is outlined in terms of access, quality, and affordability. We work closely with academia, not-for-profit sector, government, for-profit sector, and all those who make the health systems stronger. In terms of the way I wanted to structure this presentation today, I think a lot has been spoken, and Dr. Purohit has taken us through the entire gambit of what innovation looks like in Indian health sector. But I would rather talk about two case studies which may bring some light into what is the ecosystem and what is the network and design that can funnel innovations at scale. And in order to do that, I just turn this so I'm able to see the screen. I've taken the liberty of taking one case study that touches upon the academia institutions, the government, and the healthcare delivery organizations, connecting these three gambits in improving the health outcomes. So the question really is, can we connect these three dots? Is there a good case study we can look at? And I would take you through one such example which Access Health has been closely a part of, and we've been fortunate to look at it grow over the last 7, 8 years. And this is the concept of this the innovation here is around building a network, and a network of practitioners globally who have a common need, and bringing them together and doing facilitation that drives, on one hand, that caters to the network's demand and drives innovative solutions which could be applied in the public and the overall in the design of health systems across countries. And the second example is education as a leading vehicle or a leading tool to drive innovations, to reach more entrepreneurs and implant ideas, and building and supporting them through the process of the genesis of an idea to actually that idea taking seed and scaling up.